Jacaranda FM.
MEC of Health in Gauteng, Qedani Mahlangu is with us this morning.
Good morning to all the Jacaranda listeners, and it's good to be here.
This is just a couple of the calls we received in the order that we received them. And this is just from our listeners this morning. You listening, MEC? Listen.
Yes, I am.
Listen to this.
Incredibly bad at Steve Biko.
We had a bad experience at Steve Biko. They lost our grandma.
Very bad experience. Helen Joseph Hospital.
I stayed in Housebrook for a while and I had a very bad experience at Rob Ferreira.
We had a bad experience at Leratong and Joburg Jen.
We had an extremely bad experience at Steve Biko.
I had a bad experience at Steve Biko.
Bad experience at Wesrand Hospital.
Ek wil sê ek het 'n goeie experience gehad by die Pretoria.
Firstly, I want to express our condolences to family members who would have lost their loved one in one hospital or the other, because it's always important that the Department of Health, when people go to the hospital or clinic, they go there to get better. They go there to see and consult the different expertise and the specialists that we have, and senior nurses and all sorts of kind of health professionals. But often many things go right, or many times. We see more than probably 10 million visits. Yeah. Someone can come 3 times or so. But of course, I know that some people do not get good experience, and that's what we want to focus on and say, get the details of what was your experience, and I'd love to engage with each one of these people who've spoken here, so that we can look at their experiences and see what we can do.
But now the main issue to me is, and I think we need to just point that out, is that we have millions of patients.
Yes.
And hospitals are almost overrun by patients in Gauteng. And this is the problem. And we spoke to a couple of patients, and this is why we had to get involved from our Operation Healing Hands side to literally give patients operations.
We are going to reduce the backlog. We are working with the private partners, as I said, Discovery Matrix. If the Healing Hands is willing to come to the party, yes, let it be. Because we understand that people are going through pain, they're losing mobility, they're losing functionality. Therefore, some end up on the state grant when they're not supposed to be there.
What I'm saying is we need to prevent bad service.
Absolutely.
Where we can.
It's very important. The things people are saying that they were treated badly. And I mean, even last night, I got a message from someone on Twitter saying her mother waited for 5 hours at Qedani Mahlangu. We're tracing those things, but it cannot be correct that people every time they are treated this way. Yeah.
May I also say that the MEC said to me, all those people that phoned in and right at the beginning of the show that said, bad experience. You wanted all of their numbers to follow up.
Yes. We'll get all our each and every CEO of the hospital to follow through on these issues, so that we can also give feedback that people don't feel that this is a useless exercise.
Very impressive.
Whatever concerns they've got, and they should be able to get the response and closure. With those who still have questions to know about the issues.
Well done with that. So all the detail, you're going to contact the MEC, is on the Complimentary Breakfast Facebook page right now.
Jacaranda FM.